Hello and welcome to Joint Ventures. In this OSC original podcast, we take an in-depth look at the latest medical news and headlines. We sift through all the data for you guys so we can give you unbiased information in a format that's easy to understand. We know medical news and headlines can be confusing and somehow always seem to be selling you a new gadget or pill, right? That is exceedingly true of anything related to foot pain. My feeds are full of shoes and inserts and creams, so I know you guys are seeing it too. Today we are talking heel pain. But before we get into that, let us introduce ourselves. Now, if you're new to this podcast, welcome. And if you're an old timer, thanks for coming again. I'm Dr. Jenny Andrus, and I'm an interventional pain management physician at Orthopedic and Spine Center in Newport News, Virginia.
And I'm Dr. Brianna Vesley. I'm the foot and ankle surgeon at Orthopedic and Spine Center.
So, Dr. Vesley, I saw a headline, Plantar Fasciitis treatment market to hit $1.1 billion by 2031. Y'all heard me right, $1.1 billion. Now, obviously, this is a huge issue. And as the resident foot and ankle expert at OSC, can you give us a little background on this obviously painful disorder?
Definitely. So plantar fasciitis is one of the most common issues that I treat. I would say I at least see it 1 to 2 times a day. What plantar fasciitis is repetitive micro tears of your plantar fascia, which is that long band on the bottom of your foot. However, I want to really emphasize that that's not the only cause of heel pain. Other causes of heel pain includes Achilles tendonitis, which is pain more in the back of your heel, stress fractures of your heel or your calcaneal bone, acute fractures of this bone, cysts in the heel bone, tarsal tunnel syndrome, Baxter's neuritis, and even radiculopathy from your back. So what are the symptoms of plantar fasciitis? Most people will come in saying that they feel like they are having a stabbing pain in the bottom of their heel. They'll also experience something called post-static dyskinesia. And that's when, after you're sitting down, you stand up and you start having a lot of pain in your heel. The reason for that is because when you're sitting down, your plantar fascia contracts. And then when you go to stand up, it stretches out really quickly and causes those micro tears. So in general, there's over 1 million patient visits annually due to plantar fasciitis. These are 10% of runner-related injuries and 11 to 15% of all foot and ankle symptoms requiring professional medical care. It happens about 10% of the general population with a peak incidence between ages 40 to 60. It is bilateral, meaning both of your heels are impacted about 1/3 of the time. And then there's also been a lot of literature which shows with an increased BMI or increase of obesity that there's also a bigger risk factor for developing plantar fasciitis.
So that's some really important points that you're making here, that not all heel pain is plantar fasciitis.
For sure.
Everybody kind of thinks that that's the case. And of course, we co-treat a fair amount at OSC, and I do see a lot of your patients rule out that it's coming from their low back.
Yes.
But do you think some of the driver, though, of the cost is maybe that people are purchasing things for plantar fasciitis, but it's the wrong diagnosis?
For sure. I've had patients come in and they actually have a fracture or a break in their heel bone, and they've been treating it with plantar fasciitis, with night splints. And as we know, a night splint's not going to cure a heel fracture. So that's why it's always important to come in. I get an x-ray for every patient that comes in with a heel pain, make sure and rule out other causes of potential heel pain. So let's go back to the article then. So going back to the article, it reads that $778.3 million are spent in 2022, but that market is expected to expand of 4.3% from 2023 to 2031, reaching $1.1 billion in the U.S. So because of this, people are basically starting to seek more advanced medical intervention for their heel pain. That includes shockwave, orthotics, and then even surgery. North America currently has dominated the plantar fasciitis treatment market in 2022, and it's expected to maintain its leading position. So that brings us to the question of why. Why is America dominating this plantar fasciitis treatment? And then also, why are we having this ever expanding market to try to treat this heel pain? So the big reasons that we hypothesize is that we're having a more sedentary population. So with being sedentary, we're also having an increased rise of obesity. And when we're more sedentary, we're having tighter calf muscles, which directly is linked to developing plantar fasciitis. Also, obesity increases the amount of pressure on your foot, which is therefore increasing the amount of pressure on your plantar fascia.
So on previous podcasts, we talked about obesity and how it wrecks the musculoskeletal system, okay?
For sure.
But how do you explain to a patient how their heel is responding or how the anatomy is responding to the obesity?
Definitely. So every time you have more weight carrying on your body than it should, it's putting more load on your different, body parts, as you've talked about before. Especially when we think about our feet, though, it's carrying the weight of our entire body. And when we're walking or running, you're putting all of your body just on one body part. And that definitely causes increased risk for multiple foot and ankle pathologies, but in particular plantar fasciitis as well.
Gotcha.
So let's talk about the treatments, what works, what doesn't work, and then how we decide what's a good option for you. So the number one best tool to keep plantar fasciitis to go away is to treat the underlying cause. So that's beginning to stretch. We really want to be focusing on our posterior compartment of our calf. Really, this is like a pulley system. So by decreasing the tension of our Achilles, we're also decreasing the tension of our plantar fascia. One easy thing is putting a frozen water bottle in the fridge, rolling our foot over it, and that's doing ice therapy and also massaging our plantar fascia. I try to get all of my patients into physical therapy if they're okay with it and have the time, because they can really do great modalities to treat plantar fasciitis. Other options are oral medications, NSAIDs, so like ibuprofen, Celebrex, diclofenac, meloxicam. All of those can be good options if there's no contraindications. Night splints can be good as well, especially for patients who are experiencing that post-static dyskinesia. Their goal is to hold your foot at 90 degrees or beyond. So then when you step in the first thing in the morning, it's not as constricted and you're not having to rapidly expand that plantar fascia. There's a lot of ads these days for orthotics. Yes, too many on my feeds. Most of the time, over-the-counter orthotics do the trick as long as you don't have a super large abnormality of your foot. What I'm looking for in an orthotic is a semi-rigid one. Just having those plastic or jelly ones, those wear out after about a week. So we want a semi-rigid orthotic. And you can always talk to your foot doctor or other providers about potentially getting a custom orthotic and which one we would recommend. 95% of the time, this can be treated without surgery. However, I see this 100 times a month probably, so I end up operating on this 1 to 2 times a month. So for surgery, what I do is I like to do this through a minimally invasive approach. So about 2 1-centimeter incisions on either side of your heel. And then in one side, I stick a camera. The other side, I clean out your plantar fascia, and then I partially release your plantar fascia. Afterwards, I do let patients walk short distances, and then I really encourage aggressive stretching as well. One question I get a lot from patients is, what about my heel spur? They see on this x-ray, there's a heel spur right on the bottom of their heel. And they're saying that's what's causing me pain, not the plantar fascia. So why aren't you going to address that in surgery? There has been a lot of studies about if a heel spur actually causes problems on the bottom of your heel, or if it's the plantar fascia itself. Cooperman actually published a great study in the Journal of Foot and Ankle Surgery, and they showed that if you remove a heel spur versus just release the plantar fascia, patients do better if you just release the plantar fascia, and they actually get back to activity quicker as well. And a lot of people will have a heel spur even without plantar fasciitis. So surgery, I really recommend only addressing the plantar fascia and leaving that heel spur alone.
All right. Well, let me ask you. This is the burning question people want to know. Okay, so I fall into this. I am in between 40 and 60, and I've had few kids, so I've got a little weight on me. So I got all the things that make you stand up all day, all the stuff that makes you get plantar fasciitis. Okay. And I love my partners, but I didn't want them to put a needle in my heel and make me cry. So I cured mine with the most hideous shoes. I mean, I'm wearing them right now. This brand, they are hideous, but they cured me. Okay. So I'm sure people ask you all the time, specific shoe, what should I look for in footwear, maybe to prevent it or even to treat it? What do you think?
For sure. So we always want a shoe with an arch support. Flat shoes, Crocs, Hey Dudes, Toms, where they just kind of bend in half. Those are going to be terrible for our plantar fascia and our overall foot and ankle health. What I look for in a shoe is I'll take it out and I don't want to be able to just collapse it in half. So when you try to bend your shoe, you should only be able to bend the toe box. Another thing is when you wring it out, I say you don't want to be able to wring it out like a washcloth. You just want to be able to have some rigidity to it. And those are the big things I look for in a shoe. Having what's called a rocker bottom, or what looks like the bottom of a sailboat, can be helpful for your shoes as well. Hoka really kind of made this more of a prevalent type of shoe, but there's other shoes that have now come out with rocker bottom types of shoes. And that really allows you to propulse off of your foot instead of having a lot of bend.
Perfect. So my hideous shoes work.
Yes, they do. I think they're cute.
Well, thank you guys so much for joining us. We really hope that you learned something here. I certainly did. Please subscribe. We don't want you to miss out on any of the upcoming content. Thank you again. Wishing you good health. We'll see you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.